Hey, this is Dr. Chris Kelly, and in this video I'm going to be talking about stress testing, what it is, what it's used for, and what you should expect if your doctor has ordered a stress test for you. So a stress test is typically ordered to evaluate whether symptoms that you're having, like chest pain or shortness of breath, are related to a blocked or partially blocked coronary artery on the heart. And in just a moment, I'll explain exactly what a coronary artery is, what it does, and why blockages in coronary arteries are problematic. A stress test is really just looking at how the heart responds to a physical stress, which is usually exercise. And I should point out that a stress test should not be done if you're not having any symptoms that could be related to your heart and if you have no history of any heart disease. So before we can talk about exactly how a stress test works, we need to just very quickly review some basic concepts related to the heart. So the heart is shown here, and the red tubes on the surface of the heart are coronary arteries. Now, the heart is full of blood all the time, pumping it to the entire body, but the heart is made out of muscle, and that muscle needs its own blood supply to survive, and that blood supply comes through the coronary arteries. When the heart is at rest, there's a certain amount of flow through these arteries, supplying the heart with enough oxygen-rich blood. When the heart is stressed and it's pumping harder and faster than it normally does, it needs more fresh blood, and so flow through these coronary arteries has to increase. Unfortunately, if there's plaque in the walls of these arteries gumming them up, and plaque can form over many years because of high cholesterol, high blood pressure, diabetes, smoking, and other things, that plaque limits the amount by which flow can increase through this artery. And eventually you may reach a point where the plaque just prevents the flow from increasing anymore, and as a result, this part of the heart isn't getting the blood flow that it needs. And when that happens, you feel chest pain, you feel short of breath, and you have other symptoms. And a stress test is designed to reproduce those conditions and see if we can actually show that part of the heart isn't getting enough blood. So any stress test really consists of two main components. Number one is the stress itself, which is usually exercise. But if you can't exercise, we can do what's called a pharmacological stress test, in which we give you a medicine that is like exercise for the heart. And then there's the assessment of the heart's response to the stress. And there are many different ways to assess the heart's response. Number one, if you're exercising, we can look at your exercise tolerance, because people without blocked arteries, on average, can exercise longer than people who do have blocked arteries. We can also look at your symptoms and whether, when your heart is really pounding hard and fast, you experience chest pain or shortness of breath. We can also look at what's called an electrocardiogram. That's electrical signals arising from the surface of your heart, and we can see if those show any signs that part of the heart's not getting enough blood. And then finally, we can optionally add on imaging tests like an ultrasound of the heart, an echocardiogram, or a nuclear scan to provide even more information about how much blood flow the heart is getting and whether it's getting enough or not. So if you're exercising, that almost always means you're on the treadmill, and the setup looks a little bit like this. You'll be standing on the treadmill, usually with your shirt off, and you'll be connected to a machine using these EKG leads or ECG leads shown here. They're white stickers connected to wires that go back to a machine that measures the electrical activity arising from the heart. Sometimes we wrap this all in sort of a cloth bandage to help these stick onto your chest while you're exercising. In addition, you'll be working with a nurse who will be measuring your blood pressure periodically throughout the test. So once you're all set up, you'll get on the treadmill. We'll make sure that we're getting a good signal from the ECG, and then you'll start exercising. Now, most people have this incorrect belief that when we say exercise, we're talking about sprinting on a treadmill like you're in a Gatorade ad or something like that. It's not like that, although it is physically challenging, and eventually you're going to reach a point where you have to stop. So this table shows here how the exercise program works. You go through these stages 1 through 7. Each stage is 3 minutes long. You start in stage 1, after 3 minutes go to stage 2, and so on and so forth until you run out of steam and have to stop. And then you just tell us you have to stop, and the treadmill stops. The treadmill starts at 1.7 miles per hour, which is slow, although it's at a 10% incline. And at each stage, it gets faster and steeper. So by the end, you're going pretty fast at 6 miles per hour. But more importantly, you're at a 22% incline. Most people do not make it to stage 7 and peter out somewhere around stage 3 or 4. So after the stress test is done, you'll recover, and then we'll assess how you did. As I mentioned earlier, this depends on a number of factors, including how long you were able to exercise for, if you did exercise, whether you had symptoms consistent with heart disease at peak stress, and importantly, whether there were any changes on your electrocardiogram or ECG that indicate an abnormality. If you were not able to exercise or you're at high risk of heart disease, in those cases we'll add on an imaging test, as I mentioned earlier. Ultrasound and nuclear scans are among those, and we'll look at the results of those as well. For more details on echocardiogram stress tests and nuclear stress tests, there are separate videos going into those in more detail. So if you're having a stress test, there are a few things you need to know to prepare. Number one, you have to avoid certain medications known as beta blockers and calcium channel blockers, and those are listed here. You should also avoid all caffeine for 24 hours, just in case you need a pharmacologic stress test. Caffeine interferes with the medications that we use, and you shouldn't eat before the test. Finally, if you're going to be exercising on the treadmill, make sure you wear comfortable sneakers. Stress tests are usually considered very safe. There's a very low risk of complications from a stress test, but it's not zero. The chance of a serious complication happening during a stress test is about 1 in 10,000, and serious complications can include death, heart attack, abnormal heart rhythms, cardiac arrest. All of these things can be brought out by exercise. However, as I mentioned, they're very uncommon. We avoid stress tests in people who are at high risk for these complications, and we keep a lot of safety equipment in the stress test suite at all times so that if these complications do occur, we're ready to respond to them. I hope this video provides you with a basic understanding of stress testing and gives you a good idea of what you should expect on the day of your test. Thanks for watching, and stay safe.